you have the head of the epidermis. On the bottom part, you have the tail of the epidermis. This whole thing is called a spermatic cord. A spermatic cord consists of the blood vessels and vas deferens. One of the tubes that loops around the bladder is called ductus deferens, or also known as vas deferens. Right over here, you could see the urinary bladder. Urinary bladder. Over here, you could see the ureter. And these are the blood vessels that you're familiar. Common iliac, internal and external iliac, and the vein is right next to it. You also can see gonadal vein right over here and gonadal arteries. But in this case, we know the male, so basically it's also called, testicular arteries or veins. Okay. Right over here, you could see the seminal vesicle, all right, and prostate gland. Okay. And here you could see the scrotium, protecting the testes and epidermis. Over here is the penis and the foreskin called the prepuce. All right. Urogenital orifice would be the tip. So let's go ahead and remove. Here is part of the colon. That's the sigmoid colon and the rectum right over here. Okay. So you can see portion of the rectum in here too. Sigmoid colon right there. But this is the same, except that some portion has been removed, so you can see again ureter, which empties into the urinary bladder. All right. But in this case, you could see the prostatic urethra. Membranous urethra would be underneath here, and the spongy urethra would be there. So there is 3 urethra. Approximately, the length is about 20 centimeters. All right, a lot longer than 5 centimeters in female. All right, so that right over here is actually is mislabeled. It's supposed to be the seminal vesicle, the remnants of it. Right here, you could see ejaculatory ducts, and right here is the prostate gland. Again, membranous urethra would be underneath. And again, in order to see the bulbourethral gland, should be in the vicinity, but you need to remove some of the muscles. All right, the erectile tissue surrounding the spongy urethra is known as corpus sponginosum, and it's slightly superior to that. You can see the corpus cavernosum. All right. Here's another view of the same thing. All right. Right over here, you could see the spongy urethra. Over here, you could see membranous urethra right there. And over here, you could see the prostatic urethra, the highlighted areas. Ejaculatory duct, shorter and right next to it, coming in an angle from the vas deferens, which should be this one right here, or ductus deferens, same thing. Here's the urinary bladder. Again, the cells wall transitional epithelium and the ureter. Again, there are blood vessels that you should review them as well. Okay, all right. Over here, you have the testes, the scrotium, same stuff. Right over here, you can see the glans penis and the orifice, which is the opening right there. This one is kind of nice because you could see the bulbourethral gland. Here's the prostate gland. Here's the seminal vesicle. And then these are 3 accessory glands that in combination, they produce the semen that we talked about. All right. Here is the ductus deferens. Again, this is the ureter and urinary bladder. Okay, so same thing. You have membranous. In here, the prostate gland has to be removed or cut halfway to see the prostatic urethra, but you guys get the point already. Fimbriae, ampulla, and uterine tube or fallopian tube right here. Okay, here's the ovarian ligament that is connecting the ovaries to the side of the uterus. All right, again the blood vessels, ovarian vein and ovarian arteries coming in to this region. Here is the uterus. All right, so here's the urinary bladder. Probably this one is the ureter, and this one right here is the vagina. Over here you could see the labia majora, labia minora, and clitoris, and vestibular bulb, and vestibular gland. So just know the greater vestibular gland right over here. You can see it. If we remove the top part, we could explore the opening of the lumen of the uterus goes into the vagina. Again, the external genitalia. You can see the urethra, urinary bladder, ureter right there. Okay. Over here, you could see the different colors. Right over here is the lumen of the uterus. This whole thing is the uterus. All right. So the first one, endometrium, myometrium, and perimetrium. So dark, light, dark. So the colors representing the muscles of the uterus. Right over here, you could see anterior fornix, and posterior fornix. You could see the cervical areas. Right here is the cervical canal, and then over here is the vagina. The external genitalia we already went over. All right. Right here you can see the round ligament. Round ligament adhering again to the uterus to the side of the abdominal wall. Right over here is the ovary, so this ovarian ligament. And on the side, all these areas would be the broad ligament. Okay. Lateral vaginal or cervical ligament is going to be right around here on the lateral aspects of the cervix area. Here is another model that again similar to our model. Same thing. You see the wall of the uterus right over here. You see the ovaries. Okay, you could see the fallopian tube. Fimbriae is not very well shown, but it's finger-like projection. On the top is the ampulla, okay, and the uterus tube. Right over here, you could see the round ligament. All right, on the side over here, you should probably observe the, broad ligament. Again, same thing, vagina, and here is the rectum. Here is the sigmoid colon. All right, associated blood vessels that we went over. This is the top part of the reproductive system. So same thing in here. You can see the ovaries and ovarian ligament right there. So you're looking at the superior angle basically, right there. Okay. You can see the fimbriae, all right, tiny little finger-like projection, ampulla and uterine tube, and this is the uterus right there. Okay. This is the sigmoid colon. So, round ligament, you can see it. Ovarian ligament, you can see it. Broad ligament, right here. These are all broad ligament. It's called broad because from the lateral aspects of the uterus, is connecting it to the abdominal wall, these sides. Okay? So the uterus doesn't fall. This is another angle, same thing. Okay, same thing. It's just turning it on the side. Here's the uterus, here's the ovarian ligament, here's the ovaries, here's uterine tube, and the fimbriae and the ampulla. Here are the broad ligaments. All these on the side is a broad ligament. Okay, right over here you can see the round ligament. This showing you the rectum. This showing you the vagina and showing the urethra. There are three openings for it basically. Alright? the urinary system has nothing to do with the reproductive system in the vagina. All right? So that's it. If you have any questions, feel free to bring in your mom.